Now, just to give you a bit of a history about this patient, the patient was in his mid-30s and he started developing the posterior shoulder pain, and I don't remember exactly, but anywhere between 3 to 4 weeks, he was in pain and he couldn't put a finger on what triggered this discomfort. But the provocative activity was really golf, so he enjoys golf, and in the summertime here in Canada, he's trying to get the maximum time on the golf course. So now I don't have a lot of room here, but I'm going to try and get his chief complaint, which was basically as he would get on the greens, he'd hold on to his club, and as he was about to get into the position for a drive, as he brings the club back, he would feel like a lot of and then what he would also find when he was not golfing, as the condition got a bit worse, was that any kind of like reaching to the side, like if he's trying to reach back or reaching to the side, or any cross body would cause like discomfort, resting stiffness at the back. So what he had been doing up till the point that he saw me was he's trying to do a lot of like stretching because of the tightness that he was feeling in the shoulders. Now what we did, I did a full assessment, and honestly, he was a healthy person who was exercising and everything. Nothing was really significantly bad, like no special test, no severe pain except for cross-body discomfort. And so what we decided of stretch the back of the shoulder like he was already doing, and it wasn't really getting him in anywhere. This would be a classic example of overstretching the area, which is stretching into that position, so kind of strengthening PNF, strengthening at the back of the middle trapezius, deltoids and stuff like that. His symptoms start to get much better. Now this also seems to happen a lot in hamstrings. Everybody complains of like hamstrings, not pain, but hamstring stiffness all the time. And what we tend to do all the time is we try to stretch the hamstring out just because it feels stiff. What I'd rather urge you to do is to actually strengthen the hamstring. And I made a little video about what the best intervention to decrease tension through there, but strengthening might be a better idea. And another third example that comes to my mind is upper traps. Everybody complains of tension in the upper traps, and they've been stretching it for months if not years, and that tension doesn't seem to go away. A better way to manage that, if you've tried the stretching and it hasn't been helping, is to actually load your traps up with any kind of slow tempo shrugs, eccentric shrugs, face pulls. See how that feels. Hope it's a short one today. Hope that helps. Please leave me a message if there's any questions. Hey, what's up guys? So here's the video I was talking about. I in fact made this video after I saw that patient, and I often make these reels based on some of the exercise that I've been prescribing to my patients, and that's how I get the ideas. So as you can see in this video right here, the posterior cuff, the posterior deltoid, we're working on some middle trapezius strengthening and some lower trap strengthening there. So hope this helps. Hey, good morning guys, happy Thursday. So on this edition of the clinical recap, I had a case yesterday which I found really interesting, and I wanted to run this by you guys. So I had a 12-year-old patient. I have the assessments here just in case so that I want to be thorough. A 12-year-old patient who was complaining of right ankle and right foot pain, and he was accompanied by his mother, who said that he's had plantar fasciitis, and he was receiving treatment from another physio at my same office for plantar fasciitis. He used up all the benefits from his insurance and felt somewhat better, but then they didn't have enough funding, so he couldn't continue his physiotherapy, and so they had to switch to massage therapy. The massage therapy didn't really help much, and now that the next year's insurance has kicked in, they're back for physio and they want to start working on further inquiry in my subjective examination. It seemed like the NPRS pain, the NPRS was 0 out of 10 at rest and 7 out of 10 when it's worse, and that especially when he's running, swimming and walking. However, he's also pain at night when he's not really doing anything, and he also complains that the pain often tends to move on towards his shin, seems to be on the top of the foot. So if that's the foot, that I can't use my other hand, lateral border of the foot, sometimes on the top of the foot, and sometimes goes even up at the shin area. So he feels that discomfort there as well. Now he's also had the same side right hip bother him, and he's had some physio for that as well. He's also had some left foot issues now recently, and his left foot and his left hip. Right, on objective assessment, I did find, looking at his posture, that he had a big
lumbar lordosis with an anterior pelvic tilt. Again, that in itself is not that important or abnormal, but that was one of the things. Significant decrease in a straight leg raise, and a whole lot of tension and tenderness in the posterior chain, which is like hamstrings, calf muscle. The plantar fascia on itself on palpation wasn't really pain. It was generally okay with a little bit of inhibition in like some calf muscle action, which is like a little bit of plantar flexion and inversion with tib posterior, but apart from that, like nothing really. Neurological testing was all normal. So just based on that, I have a question for you. And hey, what's up everyone? Happy Monday. On today's clinical recap, we'll talk about a case that I was seeing on Friday and I mentioned about in my stories. So I had a patient who was involved in a motor vehicle accident roughly about a year and a half ago. So she was being seen by this other physio for the last couple of months, and now she has kind of gradually moved under my care, and basically she was in another vehicle, and she sustained injuries to her lower back, and her symptoms are basically, since the last year and a half, a lot of low back pain and symptoms down the leg. She did fracture her sacrum, healed, and recent x-rays in the last couple of months seem everything is fine, and she's good to start doing active based mobility and exercise. Now, while me and the other physio were talking about transfer of care, the other physio did tell me that she has been trying to push her patient into doing some kind of gentle. For the last 7 to 8 months, the approach has been generally manual therapy and not electrical, but like modalities if needed. So a bit of a passive approach. But she said that the patient was not able to even the basic movements and exercises, so she kind of leaned towards this approach. Having said that, though, she says that the patient does exhibit a lot of fear of movement, which surprised the other physio, because is a very active rower, and she rows competitively, so she has that background of training and exercise, which had her confused, and she thought like, so I've had 2 sessions with her so far. So my first session was again just getting to know her a bit and starting off with some very gentle exercises, some back simple exercises. And in our first session, she had a bit of an emotional breakdown, how frustrated this injury was and how this injury was keeping her from staying active, and it was really affecting her emotionally and other aspects of her life. So I gave her some exercises, and then I didn't see her for about 2 weeks. And my second session was very interesting, because while I was doing one of these simple exercises, again a simple ball knee to chest with her, she told me that she could start to feel some numbness going down her leg, and she could feel the disc in her back starting onto the nerve. When I inquired a little bit more about that, and I started to probably touch the topic of patient education in terms of what we know now about the disc pushing into the nerve, she almost had a bit of an emotional meltdown and an outburst, and she did mention that she felt like I was suggesting that the pain was in her head, and she felt invalidated, that I was not valuing what she was trying. To which I was just trying to tell her that I totally acknowledge her pain, and her pain, all I was suggesting was that pain might not have been because of the disc pushing on the nerve, but I was just telling her how pain can be very complex and can be because of multiple reasons. However, at that point, I asked her how she felt that it was the disc, and she said she'd seen 3 of her doctors, and one of the doctors had was a good friend, and they had confirmed that was the case, and so she was just not buying that was not a problem for her. So in my mind, and really nothing really meaningful happened in that session, and I probably even think she may not see me again, because she just felt I was not empathetic enough. Now, this is not the first time I've had this conversation with my patients. I've had this hundreds and thousands of times before, so I'm always generally very empathetic towards, and I know how tricky this can be. But having said that, this is the bias in my mind. She exhibits a bunch of yellow flags in my mind. She almost feels like hurt is equal to harm, and as much as I tried to counsel her, or the other physio tried to counsel her, it was hard to get this. She does I guess because of the doctor's beliefs in the pathoanatomical model, so she believes there's something structurally wrong with her. She has these frequent outbursts, emotional outbursts, which the other physio has confirmed. These things, in my mind, is the psycho part of the biopsychosocial model, right? Because otherwise she's a strong active athlete. So these are some of the signs and symptoms. The whole point of this story is that while there were certain deficits that I saw in range of motion, when you see patients like that, you may have some I guess special tests that are positive, restrictions, strength deficits, and stuff like that, and that's of it. But do know that that is actually a yellow flag. Those kind of symptoms, catastrophization of your symptoms, and all the other beliefs are actual yellow flags that you want to consider. The prognosis with this, well, it's going to be a bit of an uphill battle, so it's not going to be the easiest prognosis. I'm not sure if I'll be seeing her again, but if she does come in, I know like we have a lot of work cut out, and a lot of this has to be patient education. In my mind, is the true biopsychosocial model.